Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the access to care and continuity of care, ACC.
What information get transferred with patient during transfer to other facility?
When a patient is transferred to another healthcare facility, it's crucial to ensure that all relevant information is accurately and comprehensively communicated to ensure continuity of care. The information transferred typically includes clinical, administrative, and legal details. Here's a summary of the key information that gets transferred. 1. Patient identification and demographics. Full name. Date of birth. Medical record number, MRN. Contact information. Next of kin/emergency contact information. 2. Clinical information. Reason for transfer. A brief explanation of why the patient is being transferred, such as the need for specialized care, higher level of care, or rehabilitation. Current diagnosis. Primary and secondary diagnoses that are relevant to the patient's current condition. History of present illness. A summary of the patient's current medical condition, including the onset of symptoms, progression, and treatments received. Past medical history. Significant medical, surgical, and psychiatric history relevant to the patient's care. Medications. A complete list of current medications, including dosages, routes, and schedules. Include any recent changes to medications and any known allergies. Treatment summary. Summary of treatments and procedures the patient has undergone during their stay at the current facility. Details of any ongoing treatments, such as for medications, wound care, or respiratory support. Vital signs and recent labs. The most recent set of vital signs, lab results, imaging studies, and other diagnostic tests. Include relevant trends in vital signs or lab values. Advance directives. Copies of any advance directives, including living wills, DNR, do not resuscitate, orders, and power of attorney documents. Infection control status. Information on any infections, isolation precautions, or communicable diseases the patient may have. 3. Nursing and care plan information. Nursing notes. Detailed nursing notes that provide insights into the patient's day-to-day care, including mobility, nutrition, and skin integrity. Care plan. The current care plan, including goals of care, nursing interventions, and any special needs the patient requires. Functional status. Information about the patient's ability to perform activities of daily living, ADLs, mobility status, and any assistive devices needed. Diet and nutrition. Current dietary restrictions, nutritional needs, and any feeding assistance required. Pain management. Details about the patient's pain level, pain management strategies in place, and the effectiveness of those strategies. 4. Consultation and specialist reports. Consultant reports. Summaries or full reports from any specialists who have been involved in the patient's care. Recommendations and follow-up plans from these specialists. 5. Discharge or transfer summary. Discharge/transfer summary. A formal summary of the patient's stay, including the course of treatment, clinical progress, and reasons for transfer. Include any pending test results, planned follow-up care, and necessary referrals. 6. Legal and administrative information. Insurance information. Details about the patient's insurance coverage, including primary and secondary insurers, policy numbers, and authorization for transfer. Consent forms. Copies of signed consent forms for the transfer and any procedures that were performed at the current facility. Billing information. Billing and financial information related to the patient's care at the current facility. 7. Personal belongings and documentation. Personal belongings. A list of the patient's personal belongings being transferred, such as clothing, eyeglasses, dentures, or mobility aids. Medical records. Copies of the patient's medical records or a summary, including all relevant documentation needed by the receiving facility to continue care. 8. Handover communication. Verbal handover. A verbal handover between the transferring facility's healthcare team and the receiving facility, ensuring that all critical information is communicated clearly. This may include a phone call or a handover meeting between the transferring and receiving teams. 9. Transportation arrangements. Mode of transport. Details about the transportation method, whether by ambulance, private transport, or other means. Any special equipment or medical support needed during transport, e.g., oxygen, for fluids. Escort information. Information about who is accompanying the patient during the transfer, whether it's a healthcare provider, family member, or medical escort. Example of transfer documentation. Patient name, John Doe. DOB, January 1, 1950. MRN, 123456789. Reason for transfer, requires specialized cardiac care not available at current facility. Current diagnosis, acute myocardial infarction with subsequent heart failure. Medications. Aspirin 81 mg daily. Metoprolol 50 mg bid. Furosemide 20 mg 4 PRN for fluid overload. Discharge Summary, patient admitted for acute chest pain, diagnosed with an acute myocardial infarction. Treated with thrombolytics and started on a beta blocker. Developed heart failure requiring diuretics. Transfer needed for advanced cardiac intervention. Consultations, cardiologist recommended transfer for urgent coronary angiography and possible intervention. Advanced directives, DNR order in place, patient's wishes documented and communicated. Insurance, Medicare, authorization for transfer obtained. Transportation, ambulance transport with cardiac monitor and nurse escort. Conclusion. By ensuring that all this information is accurately and comprehensively transferred, healthcare providers can maintain continuity of care and optimize outcomes for the patient at the receiving facility.